The Family Medicine Service at Trinity Health Grand Rapids is our core inpatient rotation. And I think it truly embodies the essence of family medicine. We take care of patients of all age ranges, from adults, from the ICU, to postpartum mothers, to newborn babies.
Our clinic provides team-based care. We have 5 different teams that consist of interns, second and third year residents that are working alongside attendings and APPs.
As a student, I had the privilege of working with Trinity Health Family Medicine in my 3rd year on my family medicine clerkship and had a great time. I really enjoyed how wellness focused and robust the program seemed to be, and that's what brought me back for a sub-I as a 4th year medical student on my inpatient rotation, and I had a great time there too. I really got to experience how tight-knit the program was, how robust their inpatient training is, which was really important to me, to be a well-rounded, full-spectrum family medicine physician. And so both of those experiences really helped me to decide that this was the best fit for me.
In 2006, I came to Grand Rapids with my wife. We had been on a search looking for the right place for both of us. We found Grand Rapids and immediately knew that this was the right place. And not necessarily because of city size, of facilities, but because of the community that was here.
What's made this residency so special for me and really stand out to me are the people. From our attendings, our fellow co-residents, our support staff, people really do show up for one another. Our attendings are here and they bring something different to the table, whether they're passionate about obstetrics, advocacy, specialize in sports medicine, geriatric care, point of care ultrasound. There really is someone here for you if you have that interest. And what's really special and cool is that they are so excited to support you in those interests.
So I am originally from Malaysia, but I've lived in the US for many years now, and I actually started out in Michigan in Kalamazoo. So Grand Rapids was always this big city that we were familiar with. And having lived here for a few months now, there's so much to do in Grand Rapids. If you like water sports, you have the lake. If you like snow sports, there's a bunch of places to go skiing. I am the mother of a 2-year-old toddler, and so I'm always looking for ways to get all of us outside. And in Grand Rapids, there's never a shortage of things you can do.
A unique aspect of our service is that it is entirely taught by family medicine physicians. We have 3 family medicine hospitalists, along with 30 faculty and community rounders who teach in our service.
So I wanted to talk about the off rotations that you have an opportunity to do as an intern. The 3 big ones that we do are emergency department. We rotate with pediatrics, and then we also do some time up on the 9th floor on OB here. One of my favorite off rotations was the emergency department. So during that rotation, you're on for 4 weeks. During that time, you typically have 15 shifts in the emergency department, and we actually get to rotate between 3 different locations. So it's nice because you get a sense for what different emergency departments in different locations and different environments look like.
So 2 of the things that made me fall in love with the Trinity Health Grand Rapids program are the outpatient clinic and the OB track. I worked for about 3 years in a federally qualified health center before going to medical school, and that's where I learned that I really wanted to do primary care in an underserved community and that I wanted to do FM with OB. I also am fortunate enough to have received the National Health Service Corps Scholarship, which means that I'm committed to continuing to provide primary care services, and I'll do that with OB also after graduation, and that's what I plan to do for the rest of my career.
As a Canadian, I was unsure going into residency about whether or not I wanted to return to Canada to practice. I loved that at this program I got to read about, meet, and chat with Canadian residents and graduates throughout the interview process. And this program really showed me that regardless of what decision I made going back to Canada or not, I would get the help that I needed in that decision. And I think that support is reflected in a lot more ways than just this. So, you know, whether you want to do a fellowship, go out of the country, or practice in a very specific or niche way after you graduate, this is a place where you're not alone in your pursuit of those goals.
And the reason I love Grand Rapids is because it has that big city like draw with the resources and the activities, but it doesn't have the congestion and chaos of a big city. It's very family friendly, clean, easy to get around. There's a big healthcare market here, so it has all those resources that you would want as a training physician.
In residency, no matter what, you're going to be working a lot of hours, you're going to have stressful times, so it's really important that your program supports you and your wellness. Some of the things that we do here to support wellness that I think are really important is not only do we get 20 days of personal time off, but we also get 20 wellness hours, which is basically things for like dentist appointments or doctor's appointments where we can only take 2 hours off instead of having to use an entire PTO day. In addition, you don't have to explain yourself or anything like that. You can just say, I'm taking personal hours at this time. So if you just need some time for yourself, you can have that, which I think is really important.
Collectively, we provide a diverse range of skill and perspective on patient care and medical education. I think this provides such a supportive environment that really forges the bonds that make us a family. And I think that really speaks volumes to who we are as a residency.
There is, in my opinion, no other place where this community exists where you can train and get to really know and enjoy the people that you're here with. I invite you to come and check this out for yourself. Grand Rapids is a very special place, and I think that if you have the chance to experience that, you'll discover that for yourself.